Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. And this topic is about typhoid. Typhoid is a fever that results from the absence of hygiene. That's what is very common in developing countries where the sanitary measures left to be much desired. Typhoid is a serious infection and it's caused by a kind of bacteria called Salmonella enterica serotype Typhi. This bacterium spreads through contaminated food material and the main symptoms include a high fever of up to 104 degrees Fahrenheit. Along with the high fever, it can also cause abdominal pains, headache, cough, chills, weakness, fatigue, muscle aches, stomach pain, rashes, loss of appetite, diarrhea, and vomiting. No animals carry this disease, so transmission is always from human to human. It may pass from a person to person who they are carrying this bacteria, and generally from the typhoid patient, this bacteria passes out in the stools and urine. Then it's spread through food and drinking water that are contaminated with infected fecal matter. Without careful hand washing after going to the bathroom, the bacteria can move from the hands to objects or other people. Usually, this bacterium enters through the mouth and lives in the intestine for about 1 to 3 weeks. From the intestine, this bacterium gets streams into the blood of humans. The immune system of the host can do little to fight back because Salmonella typhi can live within the host cells safe from the immune system, and it can easily disrupt the intestinal wall and the bloodstream. This allows the content of the gut to leak out into the body and cause intestinal bleeding or perforations in the intestine. It makes the cells of the small intestine or large bowel to die off. Finally, that it may lead to severe stomach pain, vomiting, and infection throughout the body, which is called as sepsis. Moreover, it spreads into other tissues and organs through the bloodstream. So, other possible complications include inflammation of the heart muscle called myocarditis, inflammation of the lining of the heart and valves called endocarditis, pneumonia, inflammation of the pancreas called pancreatitis, kidney or bladder infections, inflammation of the brain and spinal cord called meningitis, and it's also cause psychiatric problems such as delirium, hallucinations, and paranoid psychosis. These life-threatening complications require immediate medical care. On diagnosis, the presence of Salmonella typhi is detected via blood, stools, urine, or bone marrow sample. Once the treatment commences, a patient has to take antibiotics, which is capable of killing this bacteria because it can be life threatening if a patient skips the early treatment. But resistance to antibiotics is increasing in some strains of typhoid nowadays. One emerging strain known as XDR has become resistant to all classes of antibiotic treatment usually used for typhoid. If a strain is resistant to a certain kind of antibiotic, then consuming that antibiotic will not kill the bacteria and the bacteria will continue to grow. But people are having vaccine option also. The typhoid vaccine is about 50 to 80 percentage effective and comes in two forms. The first one is inactivated typhoid vaccine. This vaccine is a one dose injection and it's not preferred for younger children less than 2 years old. The another one is live typhoid vaccine. This vaccine is not for children under age 6. It's an oral vaccine given in 4 doses 2 days apart. Even though if a person is vaccinated, it doesn't mean that it will give complete protection. So always follow the precise instructions when you travel into high risk areas. In medical astrology, both Rahu and Ketu have been considered to be the planet of all diseases and hidden diseases caused by infection, that is, bacteria, parasites, and viruses. Jupiter is the casual planet of life and it represents all of us. So, whenever there is a combination of Jupiter and Rahu or Jupiter and Ketu, then at such a time, infectious diseases spreads very fast, which are difficult to identify or resolve. Typhoid fever is a serious worldwide threat and it affects millions of people each year. Almost annually, typhoid affects nearly 21.5 million people. Even after the antibiotic treatment, a small number of people who can recover from typhoid fever still have the bacteria living in their bodies. And these people are known as chronic carriers. A chronic carrier is often asymptomatic and they can shed typhoid bacteria in their urine and stools and in some cases from wounds or tissues also. They may continue to spread this bacteria for more than a year after their onset of acute illness with typhoid. This makes it hard to stamp out the disease because carriers who are asymptomatic may be less careful when they are interacting with others. So sometimes the disease may also appear again. People can get a vaccination against typhoid fever, but it can't protect against all cases of illness caused by all strains of salmonella. Vaccines can help lower the risk of getting typhoid fever, and vaccination is an option if you live where typhoid fever is common or if you plan to travel to a place where the risk is high. But whatever it may be, without treatment, there is a chance for death from the typhoid fever complications, and untreated typhoid can lead to life threatening complications. So, if you observe the symptoms similar to typhoid fever, then take the right action at the right time. I hope you might have received some useful information from this video. We will meet you soon in my next video. Till then, take care and bye.